Hi, my name is Kiru, and today we're going to discuss borderline personality disorder. In this in this presentation, I'll go over an overview of the disorder. I'll talk about risk factors that contribute to borderline personality disorder. I'll talk about symptoms that cause borderline personality disorder, complications of borderline personality disorder, and treatment for borderline personality disorder. So, borderline personality disorder is considered a mental health disorder that impacts the ways that individuals think about and feel about themselves, others, and the relationships they have in their life. Borderline personality disorder can contribute to extreme difficulty in daily functioning of life. Risk factors. So the risk factors that contribute to someone developing borderline personality disorder includes genetics. So often, if there's a history of personality disorders in family or other health issues in the family history, this can contribute to a borderline personality disorder. Also, brain abnormalities contribute to borderline personality disorder. So there's a lack of serotonin in the brain, then this is more likely to cause the borderline personality disorder. An abusive childhood, specifically sexual abuse or physical abuse, can also contribute to borderline personality disorder. A stressful childhood, which includes the death of a parent at a young age, or having a parent or one parent or both parents with substance misuse issues or mental health issues, it causes borderline personality disorder. Specifically, if you have a hostile family life or unstable family life full of conflict in their relationships, then you are more likely to have borderline personality disorder. So, what are the symptoms of borderline personality disorder? So, one of the main symptoms is there's self image issues. There's also a high prevalence of the inability to regulate emotions. There's also a high chance of having a history of unstable relationships. People with borderline personality disorder also have an intense fear of abandonment, and they often experience instability in their life. They can't tolerate being alone and will often go to extreme measures to not be abandoned or rejected. Sometimes this would include abandoning and rejecting other people before they are rejected. There's also intense anger that borderline personality disorder people experience. Often, this is inappropriate anger or just a general hostility. Um, there's also a tendency to be impulsive and experience mood swings. So, the mood swings could be extreme happiness to rage at another time. Borderline personality disordered people also display avoidant behavior. They have a history of idolizing people and then discarding them. There's also rapid changes in identity. So often, people with borderline personality disorder will shift goals and values. One minute they'll say that they believe in this, and the next minute they believe in something completely in the opposite direction. Often, people with borderline personality disorder see themselves as bad or non existent. They have high stress, they're highly paranoid, and sometimes they can lose touch with reality. This can last up to a week, or sometimes is just for hours of days. Um, Again, the impulsivity and risk taking behavior is very prevalent with people with borderline personality disorder. So, this includes gambling, unsafe sex, sprees, binge eating, and also suddenly quitting a job or ending a positive relationship. Finally, people with borderline personality disorder also experience suicidal ideation. So, what are the complications of having borderline personality disorder? So, again, it can lead to multiple suicide attempts and eventual completion of suicide. There's a high risk of suicide for people with borderline personality disorder. There's also often legal complications. So, people with borderline personality disorder tend to have a high degree of criminality and incarceration. Often, people with borderline personality disorder are unlikely to finish school. So, often they drop out early or just do not complete post-secondary education and sometimes high school. But there are instances of people with borderline personality that are very successful in school. But those people also experience extreme stress while attending school. Also, there's often repeated or consistent job loss. There's often marital stress and divorce. Um, there's a high prevalence of conflict filled relationships, and these poor relationships also contribute to self harming behaviors such as cutting. Often, these relationships can be abusive, and there be a history of abuse in their intimate partner relationships. Often, people with borderline personality disorder are hospitalized, so there's often more than one case where they are hospitalized. There may be early or unplanned pregnancies. They often experience STIs. They have frequent fights in their relationships. They experience motor vehicle accidents, and they often engage in risky behavior to deal with their symptoms. This includes unprotected sex, reckless spending, and poor eating habits. They also have other mental health issues. So, people with borderline personality disorder often have concurrent mental health issues such as eating disorders, anxiety disorders, ADHD, bipolar, other personality disorders, depression, and substance misuse issues. There's a lot of repetition in this presentation, but it's just to drive the point home. The borderline personality disorder is a very serious mental health issue and can have debilitating effects on one's life. It's really important to look and pay attention to people, or if you yourself have the risk factors, and get help immediately. Borderline personality disorder is something that can be treated. It's not curable, but can be treated. Um, So, psychotherapy is considered a good form of treatment. Often, people with borderline personality, it's good if they are hospitalized. In terms of the types of therapy, dialectical behavior therapy is one of the most effective forms of therapy for people with borderline personality disorder. There's also schema focused therapy, mentalization based therapy is also suggested. There's also something called systems training for emotional predictability and solving, which is called STEPS. Which is also helpful to people with borderline personality disorder. There's also transference focused psychotherapy. Um, that should say meditation, and then medication. It should say medication, psychiatric management such as antipsychotics, mood stabilizers, and antidepressants. Um, so just to go over each of the types of therapy. So DBT includes group and individual therapy. It's designed specifically to treat borderline personality disorder. It uses the skills-based approach to teach you how to manage emotions and tolerate distress and improve relationships. Whereas schema-focused therapy is done individually, and it can also be done in groups, but it helps you identify unmet needs and that have led to a negative life patterns, and so it's helpful insofar as it helps you understand how you've been able to survive and how that survival mechanism or coping patterns are not helpful now that you are adults, and how they're hurting your life. They may have been helpful when you were a child or when you were growing up, but they're no longer helpful. So it helps you, this therapy helps you get your needs met in a healthy manner that promotes positive life patterns. There's also mentalization based therapy, so it's called MBT. It's a type of talk therapy that helps you identify your thoughts and feelings at any given moment, and then it helps you create an alternative perspective for what you're thinking and feeling. So this emphasizes thinking before you react, because often people with borderline personality disorder are very reactive, and this is asking you to think and respond in healthy ways that's good for you and the people around you. Finally, there's systems training for emotional predictability and problem solving. STEPS, it's considered a 20-week treatment that involves working in groups that incorporate family members, caregivers, and friends. Or any other significant treatment that's important for you. It's usually used in addition to like psychotherapy and other forms of counseling. Finally, transference focused psychotherapy, also called the psychodynamic psychotherapy, it's TFT P for short aims to help you understand your emotions in interpersonal relationships and why you have certain interpersonal difficulties. And it does this through helping you develop a relationship between you and your therapist. You can apply these insights to ongoing situations in your life outside of therapy. Finally, good psychiatric management, again, in the form of medication. So this involves good case management. So the person who's your psychiatrist will help you with your medication, but also help you with figuring out your expectations for work and school while you're on medication. So psychiatric management also helps people deal and focus on difficult emotions, and they do this by incorporating their interpersonal context and looking at how people with borderline personality disorder react to the people in their life and their feelings around that. The goal is to integrate medication with groups and family education and individual therapy. That is the end of my presentation. Thank you so much for listening.